Ever since I got 135 rank, I've heard this line again and again. इतना अच्छा रैंक लेके सर्जरी कौन लेता है? रेडियो या डर्मा लेना चाहिए था ना? But let me tell you one thing. Your rank has nothing to do with the branch you choose. And just because you got a high rank, that doesn't mean you have to compromise on what excites you. Now, imagine someone who has always dreamt of being a surgeon. But when the NEET PG results came, his rank was in top 10. Now, everybody started saying to him, why will you waste a rank? Toppers don't choose surgery. Toppers always choose radiology. So go for radiology, don't waste your rank. So he listened to them and he chose radiology. Now what happens after a few months? He's posted in the emergency, okay, and he's sitting on his laptop and he's reporting a CT. When his eye caught an X-ray which was placed in the view box, this is what the X-ray looked like. And the moment he saw the X-ray, he knew the patient had to be taken to the OT immediately, because this is an X-ray of a perforation. But he can't take him to the OT. He has to call a surgeon or he has to tell a surgeon to do that. Now, in this moment, regret hits him harder than the salary or the lifestyle which he had chosen. Because in that moment, he'll be thinking, Kash us din surgery utha liya hota. I would have been the one to save this person's life, isn't it? So here's the truth. Your branch is your own calling. It's not some kind of trophy for whatever rank you've got. Let's suppose you have gotten rank 1. It doesn't mean you have to choose radio or Derma just because you have gotten a good rank. And it is the same situation for the opposite as well. Just because you have gotten a lower rank doesn't mean you have to settle for less. You need to always prioritize your branch, and your branch is not equal to whatever rank you scored. And I'm not that kind of guy who likes to sit in a place and just do that reporting kind of job, or just go through the diagnosis, or be in the back seat. I'm the kind of guy who likes to take things in his own hands. I'm that kind of guy who likes to live on the edge, who loves that adrenaline rush, and I like to see the results with my own eyes. Because let's suppose if you have a patient of perforation, right? You know what you're supposed to do. You can see that there is a hollow viscous perforation and you can treat it with your own hands. And the satisfaction you get after saving a patient with your own hands, it's unimaginable. It's even better than skydiving or scuba diving. So don't choose a branch just for the sake of quick settling or just for money, because 30 years later you're going to have money with whatever branch you choose. But regret is the thing I don't want you to have in that position. I don't want you to sit and think, I wish I had chosen some other branch, my life would have been different. Because whatever branch you choose, if you're passionate enough, if you put your heart into it, sky is the limit for your earning. You can be a millionaire with any branch. It doesn't matter even if you choose anatomy or physiology. You can be the best in your field if you're passionate enough. So don't be biased with what others tell you. If being in an OT makes you happy, then choose surgery. If being in the backstage, if you don't want to face the patients, if you just love technology, then choose radiology. If you love aesthetics and if you prioritize lifestyle more, then choose branches like dermatology. So it's entirely up to you what your heart says. And don't choose any branch just because you feel you'll settle early, just because you feel immediately you will be earning good money. Because with the advent of AI, your career can be in danger as well if you're not passionate enough or if you're not the best in your branch. Let me tell you how. Now, for instance, let me upload an X-ray to ChatGPT and ask him to report it. Report this X-ray as an experienced radiologist. Let's see what he'll tell us. Patient not specified. Study it's a chest X-ray. Quality is good, and he reports there is free diaphragmatic gas noted under the right hemidiaphragm, which is highly suggestive of pneumoperitoneum. And he has recommended to do urgent surgical evaluation to identify and treat the underlying cause. So he diagnosed the X-ray in an instant. So what if I develop an AI app exclusive for radiology? I develop an app and I feed him all the standard radiology textbooks. I feed him hundreds of X-rays, hundreds of CTs, MRI images, and teach him how to diagnose a CT step by step, how to read an MRI step by step. How do you think he'll perform when compared to a newbie radiologist? And there was also a study conducted which had compared AI with a radiologist, where even a well experienced radiologist had missed a fine detail, but AI was able to catch it. So This is what I want you to remember. Don't choose a branch just for the sake of money or just to settle in early, because you never know when you will be replaced by AI. I want you to be passionate enough. I want you to put your heart into your branch. I want you to be irreplaceable. And remember, this NEET PG rank doesn't hold any credibility once you enter the residency. Nobody is going to ask what was your rank. You will be treated the same even if your rank was 1 or even if your rank was 1 lakh. That high rank of yours will just help you choose the college of your choice and the branch of your choice and nothing else. It's not some kind of trophy or medal if you think people will treat you as a special person just because you had scored a high rank. Believe me, it doesn't work like that. Once you enter the residency, your rank will not matter anymore and you start from zero. Again, you have to forget whatever rank you have got. So that's it for today's video. Please make sure to share this video to anyone who has got a good rank and is confused what branch to choose. And if you're choosing surgery, please make sure to watch this video before you enter the surgery residency. And please mention in the comments if you want me to make more such videos on choosing your branch. Subscribe for more videos and thank you for watching.